Hello, Professor. This is Brenda Ramirez. I'm gonna just be sending a recording. I have my blank piece of paper that you stated I can use. It's blank on both sides, and my pen. This is my brother that he was able to come in. He already signed the form for informed consent, and he filled it out, which I will be sending it in to you. All right, so I'm gonna come in and I'm gonna introduce myself. Hello, my name is Brenda Ramirez. I'm a family nurse practitioner student, and I'm here to be doing a wellness exam. Okay, just before I begin, do I have consent from you so that I can record this
Yes, you do.
assessment? Great. I'm gonna start off with assessing the chief complaint. Can you tell me why you're in here?
Doing my yearly exams.
Yearly exam. Good. And then can you just tell me your name, date of birth,
Rubén Caballero, May 2nd, 89.
gender?
Male,
Okay. And then ethnicity?
Hispanic.
Hispanic. Okay. And now I'm gonna just ask you a couple questions just to get a little bit general idea about your history. So I'm gonna start off with have you had any chronic conditions?
No,
No chronic diseases?
no,
Any hospital visits?
no hospital visits.
Okay. Any illnesses?
No illnesses.
Recent serious illnesses?
No.
Surgeries?
No surgeries.
What about medications? Do you take any over-the-counter medications?
No medications.
Any prescribed medications?
No prescription.
Any herbs?
No herbs.
Okay. All right. Do you have any allergies?
No allergies.
Seasonal allergies, environmental allergies, latex allergies?
Zero allergies.
Okay. Any traumatic injuries that you've had?
No.
Any serious infections that you've had?
No.
And what about transfusions?
Mm-mm.
Have you had any transfusions?
No transfusion.
Okay, so no transfusions, and then what about, have you been tested for HIV or STDs?
Yes.
You have, and how do those results come back?
All negative.
All negative. Great. And now I'm just gonna assess for your social history. So who do you live with?
With my wife.
Okay, how long have you been with her?
11 years.
Oh, awesome. I've been about 10 years, so we're about the same. Awesome. And then how many people live in your house? Just you and your wife?
Yes.
In a home? What's your occupation, you would say?
I'm a manager in a casino.
Okay, manager. Awesome. Do you do a lot of walking around, sitting down?
I'm normal. Average.
Okay, not too
too
long
much.
sitting down, not too long. Okay.
Yeah.
Awesome. And then, are you in a monogamy relationship with your wife?
Just me and her for
Just
11
you.
years.
Okay. And then, do you smoke any tobacco,
No,
alcohol,
I don't drink.
liquor,
No,
marijuana?
no.
Okay. What would you say you do for your activities? What do you do?
24-hour fitness.
Uh-huh.
Play basketball. I swim. Sauna. I
Okay.
lift weights.
Okay. And then, do you do those kind of things for fun?
Yeah,
Well,
just for fun.
how would you describe your eating habits?
I'm on a vegetarian diet right now. I'm trying to put as many vegetables and fruits in my body. Alkaline water. I don't drink soda. I try to stay away from acidic stuff. Trying to be alkaline.
Okay, good. And then how would you describe your stress?
I don't stress.
No,
No.
stress. You have no stress in your life. And what helps you help relieve stress if you do feel stress?
Running.
Running, you go out. Run.
Yeah.
And then do you have family to help you out?
Family to help me out.
Yeah. If you ever.
Yeah.
Okay, so you have a good. Do you have any religious preferences that can change care?
No. No religious.
Okay. And so no kinds of. And then, do you feel safe at home?
Yeah, I feel safe at home.
Okay. Have you been in the military?
No military.
No military experience. Okay. Great. So now I'm just gonna ask you about your family, just family history, get a little bit. Oh, and have you been depressed lately?
No
Have you felt
depression.
no depression? You're usually walking around.
Yeah.
Okay, staying active. Um, and okay. Uh, and now I'm just gonna ask about your family. It could be your mom, your dad, your uncle, your brother, any close relatives, and you can just tell me yes or no or further information. So, has your family been diagnosed with any neural problems, any problems with the brain, like strokes? Have they had any of those issues?
No, none of
What
that.
about cardiac, heart failure?
No car
Uh,
failure.
okay, no strokes, no heart failure. What about GI? Have they have any problems with their stomach? Uh,
No.
um,
No stomach problems in
okay,
my family.
like diverticulitis,
No.
colon polyps. No. Any of your problems? Your parents had cancer. It could be breast, colon cancer, skin cancer,
No
eye
problems.
problems. No.
None of that.
Any of your parents have glaucoma, blurred visions,
No.
blind. What about your family? Have any signs of deafness in your parents or
No.
imbalance problems?
No, none of that.
Your parents have any nose problems that you can know, like allergies or problems breathing?
Nope.
Any problems with the mouth that your family has, like
No.
no?
No mouth problems.
Okay. Any throat problems, like endocrine problems that your family has weight loss or severe weight extreme obesity?
Nope. No
No.
obesity. We're all
Okay.
pretty thin.
Okay. Your family, any of your family have problems urinating?
No.
No problems urinating. They have no kidney problems,
No kidney
liver
problem.
problems,
Nope. None of that.
spleen. Do any of your family have rheumatoid arthritis?
Nope.
Or know that they have some type of bone malformation,
No.
skin malformation?
No.
Any of your family has depression?
No depression.
Any alcohol?
No alcoholism.
No alcohol or substance abuse?
No substance
Okay.
abuse.
All right. And none of them have psych problems either.
No, they're all right in the head.
Okay. Good. So it looks like your family is pretty healthy. Now, the same questions that I asked you, I'm going to be asking. Uh, I will be now. I think Professor, you just wrote to me. um, so now, do you have any? Now I'm going to ask you the same questions about you. So, do you have any problems? Have you been having headaches, loss of balance,
No.
no skin problems that you've noticed, any rashes that you noticed, or moles that continue and grow?
No.
No.
None of that.
Okay, great. So no hair problems that you notice you're losing hair.
Mm-mm.
Any visual problems that you've noticed, like blurred spot, double vision,
No.
loss of vision?
No visual
No.
problems.
Okay. Have you had any problems breathing? Any allergies?
I breathe just fine.
Okay. Have you noticed that you've been losing some type of hearing?
Nope. My
lately?
ears are good.
Yeah, and no drainage coming out or no. Okay. What about mouth? Are you having problems eating or pain in the mouth? Any trouble?
No problems in my mouth.
Okay. Have you had any trouble with that you notice that maybe your throat is getting inflamed or you
No.
feel fullness or
No.
tightness? Are you able to move your neck freely?
Yep.
Okay, good. Any problems moving your bones, musculoskeletal problems? No problems? Okay.
No problem.
And then have you noticed any, like you having to sit up with, or you felt some type of palpitation lately? No,
No.
palpitations? And then breathing, have you had any problems breathing, taking a deep breath?
No.
No?
My cardio's good.
Okay. No lung, so you haven't had trouble breathing at all?
At all.
Even on exertion? Okay, good.
Even
And then what about bowels? When was your last bowel movement?
this morning.
Okay, and it was normal? Was it nice and brown?
Normal.
As usual? When was the last time you saw your eye doctor?
My eye doctor was 3 months ago.
3 months ago. So you've been able to go in. Okay. And then so same with have you gone to your dentist?
Dentist, yeah.
And you've had no issues with either one, no cavities?
No cavities. none of
Okay, okay, great. And then So also, I wanted to state that if the patient came in for a problem-focused assessment, I would assess I would assess the HPI, what the patient's coming in here for. I would ask for onset, location, how long it's been present for, the duration, the characteristics, what aggravates it, what relieves it, how long this has been in, how long this timing of the pain has been, and the severity. I would ask him for how severe the pain is. But because he's not, I'm going to continue and do this. General just a general overview about how he is. Um, we're talking about, you said your GI, you had no problems with your stomach, no problems urinating. Is your pee, you go to the bathroom frequently?
Yeah,
How much water do you drink?
at least 2 liters a day.
Okay, so you're drinking a good amount of water. Is your urine nice and clear, not dark yellow?
No dark
Okay,
yellow.
and no problems with urinating?
No problems.
Okay. And then we talked about your bowel movements. You had no problems going that way. Any problems moving, range of motion, walking, imbalances,
Nope.
and no
problem.
skin problems, and no, you haven't been feeling depressed lately?
Nope.
Okay. Great. And no more stress than normal?
I don't stress. I don't
Okay.
really know.
Okay. And have you had any allergies recently?
I don't have allergies either.
Okay. And no more no weight loss or weight gain quickly?
Nah, I stay at my normal weight.
Okay, great. So that sounds about, we've pretty much covered all our bases. Now I'm going to start your full assessment, if that's okay with you.
Yeah.
I'm going to start off by looking at his skin, general appearance. I'm looking just to get an overview about his skin. I'm looking at the front, and I'm also going to locate the back side. And I want to make sure that I don't see any type of lesions, especially the back, because patients often, most of the time, they can't see the back side, especially if they have a mole that changes colors, or and I'm also looking for any erythema that he might have, any jaundice. I want to look at the whole general skin, and I want to look at his nails throughout. And as I'm looking at the skin, I'm doing the capillary refill. Make sure that he's less than 3 seconds, and I'm looking to see if the skin turgor is good, which he's well hydrated. Great. And I'm looking at the bottom of his eyes. I like to look at the overall skin, make sure that there's no signs of jaundice. And I'm going to look at the lower extremities. Great. Looking at all the extremities and his feet as well. I'm doing capillary refills. And I'm also looking at the bottom of the feet. Especially I want to look at the bottom of the feet for any diabetics. Make sure that they don't have any kind of problems with the bottom of their feet. So now that I'm done assessing the skin, overall, there's no erythema, nodules that I noticed. The only thing I do notice is his tattoos, and I want to look for any signs of infection on his upper thorax, and then his lateral, the mid-axillary line. Also, there's no signs of infection. Great. So now I'm just gonna. He is calm, oriented. Can you tell me why we're in here?
For my yearly exam.
Okay, and then what date is it today?
Today
Mhm.
is it April 24th?
The 25th.
25th,
Yeah,
yeah.
you're close. And then where are we?
In my mom's house.
Okay, so he's oriented to he's alert oriented ×4 to place, time, situation, and he is appropriate. He's calm, free from distress. His skin is appropriate to his age, and also I'm just assessing his overall appearance. Make sure he's free from any signs of obesity. Nutritional status is appropriate. And I'm also gonna start off by assessing his vital signs. What height would you say you are and your weight?
6'1", 185 pounds.
Okay, and then I would calculate that to make sure his BMI. Also, I would do his vital signs, respirations, 16, blood pressure 120/80, temperature 98.5. And are you in any pain?
No pain.
So 0 out of 10. And I would also I would assess, respiration. I would basically assess all his vital signs, and they're all good. I'm gonna start off by doing a visual acuity test. So what we're gonna do is you're gonna look, and this is cranial nerve number 2 that we're assessing. You're just gonna, cover your eye.
EPTZOCFDHJLTFPH.
Great. So visual acuity is 20/20 on the left eye. Now you start.
EPTZOCFDHJLTFPH.
Okay, so visual acuity is 20/20 bilaterally. Now can we do it with both eyes?
EPTZOCFDHJLTFPH.
Okay, visual acuity cranial nerve number 2 is intact. He's pretty intact. I already assessed his skin, and now we're gonna start off with assessing his eyes. So, Mr. Caballero, I'm just gonna start off by assessing your eyes, and I'm just looking to make sure that the pupils are equally round and react to light and accommodation consensually and direct, and they do. They're about a +3, and then with light they turn about a +2. And I'm gonna assess for extraocular movements as well. So you're gonna look at my finger, and we're gonna move sideways. Okay, so you're gonna follow my finger, and this is cranial nerve number 3, 4, and 6. The oculomotor, trochlear, and abducens. Great. So extraocular movements are intact to all visual fields. I'm also, now that we looked, I also like to look, which I looked earlier at the skin, but you want to look at that sclera, the conjunctiva, the iris. Sclera is nice and white. The conjunctiva is clear. The iris is nice and brown. There's no signs of inflammation or jaundice that I noticed, or any type of erythema. Next, I'm gonna do the optic. I'm gonna assess. I'm just gonna look at your eyes. I'm gonna look at the optic disc, optic nerve. So I'm looking for that red reflex, right eye to right eye, and I'm looking at the optic disc, optic cup ratio 2/3, and and I'm also looking, make sure it's nice and orange, the optic disc, and there's a vessel to each artery, and also the vessels have pulsation. So I'm gonna take a look again. Left eye to left eye. I'm looking at I'm doing this fundoscopic exam, same thing, optic disc, cup ratio 2/3, it's nice and orange, and there's a vessel pulsation to each eye, along with an artery to each eye. So, and a good red reflex. Okay, great. So now that we're done looking at the eyes, I'm gonna start off. I'm gonna just also assess your temporal artery and make sure that it's a +2. Okay, it's about a +2, and it's symmetrical bilaterally, irregular rate. There's no sign that I don't feel a thrill, and I'm also assessing his TMJ. Can you open and close your mouth? Any pain?
No pain.
No pain. Great. TMJ, and I'm also gonna just assess your maxillary sinuses. Any pain?
No pain.
No pain. Okay, great. Now that we did that, I'm also gonna I'm looking for any jugular vein distension. While I'm just doing all that, I don't see any jugular vein distension. Now I'm gonna just take a look at your ears. We're gonna do, I'm gonna do an assessment. So first, we're gonna start off with a whisper test. I'm gonna have you close your eyes, and I'm gonna whisper 3 words to you. Can you please tell me what I say?
Apple, ball, and banana.
Okay, great. And this is the acoustic cranial nerve number 8 again.
Apple, ball, banana.
Great. Your cranial nerve number 8 is intact, and I'm gonna do the Weber test. Make sure this is for bone conduction. Let me know if you hear this in both ears.
Yeah.
Okay, so Weber test is intact. Now I'm gonna do the Rene test. Tell me when you no longer hear it.
I no longer hear it.
Do you still?
I hear.
Okay. So this is a Renee test, and it is intact.
I no longer hear it. Yeah, I hear it.
Okay, great. So the Renee test is intact. Now I'm gonna just assess the external part of the ear. I'm looking at the ears. Do you have any pain? There's no drainage.
No drainage.
Great.
Okay.
There's no pain when I pull the peanut up and back.
Nope.
No tragus pain.
No triggers.
And I'm just looking at the at his ears. Make sure there's no signs of obstruction. I'm looking at his tympanic membrane. It's pearly gray, and there's no swelling. Tympanic membrane is pearly gray. Cone of light. It's at the 5 o'clock to the eardrum, to the right eardrum. So that's normal. Now I'm gonna look at his left ear, assess the same, the external ear part, and then I'm gonna go in. Tympanic membrane, pearly gray. Cone of light, 7 o'clock to the left eardrum. Okay, great. Next, I'm just gonna take a look at your nose. So I'm looking at his nose, and I'm just making sure there's no deviations, there's no obstructions, there's no nasal discharge. And can I look at your nares? Okay, great. Okay. His nasal turbinates are free from erythema. There's no signs of infection. I'm also going to assess cranial nerve number 1. This is cranial nerve number 1, olfactory. So what you're going to do is you're going to close one there. Close one there. Close your eye and tell me what you smell.
Yes,
Okay, great. So now you're going to close the other nerve.
that's coffee.
Great. So cranial nerve number 1 is intact. Thank you, Mr. Caballero. So now I'm going to assess the mouth. And I'm just looking at the overall mouth, make sure that he's able to smile, symmetrical. There's no signs of cavities or blue pallor dislocation, it's symmetrical. I'm also looking at the uvula, make sure it rises. You can actually bring your tongue down, and I'm looking at the uvula, make sure it rises, symmetrical. And I'm looking at the tonsils, make sure they're about a +2. They're not touching each other. And tongue is midline. I'm also going to have you, so I'm going to assess cranial nerve number 5, which is going to be, we're going to assess, you're going to close your eyes, and you're going to tell me whether you feel this is sharp.
Mm-hmm.
You could just say soft, okay?
Mm-hmm.
This is cranial nerve number 5. This is trochlear.
That's sharp.
Yep.
It's soft. Sharp. Soft. Sharp. Soft.
Okay, great. So, can you smile for me? Good. Trigeminal. Okay, this is cranial nerve number 5, trigeminal. So good. So you're able to smile. Now we're gonna do the facial. You can open up your eyes again. We're gonna do cranial nerve number 7, the facial. So can you frown for me? Yeah. And then also I'm assessing the upper and the lower facial muscles. Can you puff out your cheeks? Smile. Great. Everything's symmetrical. Cranial nerve number 5 and 7 is intact. I'm gonna also assess his cranial nerve number 9, 10, and 12. Glossopharyngeal, hypoglossal, and vagus nerve. I'm just gonna be I'm gonna have you stick out your tongue for me. Make sure it's symmetrical. Say ah. Uvulas rises to midline, and then can you swallow for me? Good. So trachea is to midline. There's no signs of deviation or swelling to the thyroid gland. Great. Can you push against me? Push your tongue, I guess. Yeah, I'm assessing the tongue strength. So it's about +4 in strength, good. And it's symmetrical bilaterally. There's no signs of cavities or redness. And now I'm going to assess cranial number cranial nerve number 12, which is the accessory. You're gonna push against my hand. Push, 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 push with your hand. With your hand. No. So you're gonna like that. Yeah.
Right.
Push, push, push. Great. Push. Great. Now shrug your shoulders. Great. They're about a +4. There's no signs of asymmetry. Now we did that. I assessed already jugular vein distension, and I like to just feel the carotid pulse. Great. It's about a +2. Okay. So it's about a +2 on both sides. They're pretty symmetrical, but I don't want to do it on both sides because I don't want him to pass out. So you do one and then the other. I'm also gonna just, since I'm already here, I'm just assessing his preauricular and postauricular, his occipital. I'm making sure that any lymph nodes are swollen, and his subclavicular, submental. Okay, there's no signs of inflammation in his lymph nodes. I'm also gonna he's can you push against my hand? I'm also assessing his strength. Push down, great, +4. Push back, great. And lymph nodes are free from any swelling or distension in his neck or his and no jugular vein distension. Now I'm gonna look at his thorax, make sure that it's rising and it's rising symmetrical, and I'm looking at his respirations. There's no signs of distension or abnormalities to his chest. Or now once I do that, I'm just gonna palpate. And are you having any pain?
No pain.
And upon palpation, I'm also assessing to see if he has any thrills, especially at the PMI point at the aorta. There's no thrills noted. Often with skinny, with people who are very thin, you might be able to notice it, but I don't notice any thrills. Great. And no crepitus? There's no pain, tenderness?
No pain, none of that.
Okay, good. Now I'm just gonna, now that I've palpated, I'm gonna percuss. Resonant sounds. Great. Okay. Resonant sounds on bilaterally. I already palpated. Now I'm gonna assess tarsal fremitus. So I'm gonna have you say 99. Make sure she can see.
99, 99, 99, 99, 99, 99, 99.
Great, symmetrical. It's symmetrical. I'm also gonna assess. You're gonna take a deep breath. Let it go. Okay. Again, one more time. Okay. Chest rises symmetrically. There's no signs of deviation or malformation. I'm also gonna start auscultating. And I'm gonna just auscultate his lung fields. And I'm gonna go into lateral motion. So you're gonna take a deep breath with your mouth. Let it go. Great. Okay, good. 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 Vesicular breath sounds that I'm hearing. If I'm going too fast, let me know so I can slow down. Are you okay? Yeah? Okay, good. Nice vesicular breath sounds. Now I'm going to listen also to the, I'm going to listen, now that I finished listening to the lungs, I'm going to listen to his carotid artery, free from bruits or murmurs. And I'm going to listen with both the diaphragm and the bell. Great. I'm just gonna listen to the aortic, which is on the right intercostal space, right sternal border, second intercostal space. There's no murmurs. I just hear S1, S2, no S3 or S4 sounds. Great. Now I'm listening to his pulmonic, which is the left sternal border, second intercostal space. I hear a good S1, S2, no extra sounds. Now I'm looking at the Erb's point, which is on the left sternal border, second and third intercostal space. Listening with the diaphragm and the bell. Great. Now we're gonna go one more down. Fourth intercostal space, which is the tricuspid area, fourth intercostal space, left sternal border. I hear a good S1, S2. Good. His heart sounds nice and healthy. S1, S2, no extra sounds. And now I'm going to go to his PMI point, which is mid-clavicular line, fifth intercostal space. Great. And I'm just listening. I hear a good S1, S2, free from murmurs. And I listen with the bell and the diaphragm. And now I'm just going to listen on this side. Good. Now I'm going to go to his backside, posterior field. I'm looking for symmetry. Make sure that that the back rises. Actually, can I have you kind of look back so she can look at what places I'm looking at? And then I'm going to have you after. Sorry about that. I'm going to have you go forward. And then I'm just looking at his backside, make sure there's no signs of swelling or deviation. His chest rises symmetrically. I'm going to assess his diaphragm expansion. Can you take a deep breath? Good. Symmetrical chest rise expansion again. Good. Now I'm just gonna assess his tactile firmness. So I'm gonna have you do 99.
99, 99, 99, 99.
Good. There's no pain
No,
to palpation. Okay, good. And now I'm just gonna start percussing. I'm gonna just if you actually bring your arms out like this. Yep. Just so I can bring out that trapezius muscle. Any pain?
Okay.
Good, good. Okay, a resonant lung sound bilaterally. There's no extra hyperresonance to any area. So now that I percussed, I'm gonna do diaphragmatic excursion. So I just need my pen, which I was using right here, and I'm just gonna. So what I'm gonna have you do, Mr. Caballero, is you're gonna take a deep breath, and let it all out, and exhale and hold it, and then I'm gonna quickly go down till I hear dullness. And hold it. Okay, right here. Great. Okay. Now I'm gonna do the same thing. Oh wait. Now hold it in. Hold it in. No. Breathe in and hold. Okay, good. So it's about about 4 centimeters, which is normal. Now we're going to do the same thing on the other side. So you're going to breathe it up. Okay. Good. Now take a couple deep breaths if you're good. Okay. Tell me when you're ready. And it's pretty symmetrical from one lung to the other, so that's good. Next, now that I palpated his posterior lung fields, I'm going to now start auscultating. And again, I'm going to have you bring your arms out forward so it can move out. Okay. Okay. Take a deep breath. Great. Nice vesicular lung fields on the posterior side as well. Can you turn around for me now? Everything pretty much symmetrical. And now I'm going to go back and I'm going to start assessing his stomach. As I assess his stomach, I'm going to also be listening to his cardiac. And I'm going to listen to the same area. So I'm going to have you lay down, Mr. Caballero. And I'm gonna listen first to finish off my cardiovascular. And I'm gonna listen to his carotid as well. Make sure there's no murmurs. Okay. Now I'm gonna listen to his aortic point. Right sternal border, second intercostal space, pulmonic. Oh, I'm gonna listen with the bell as well. I hear it at nice S1, S2, no extra sounds. That's the pulmonic left sternal border, second intercostal space. Now I'm going down to the Erb's point, third intercostal space, left sternal border. That was Erb's point. Now I'm going down to the tricuspid area. That's the fourth intercostal space, left sternal border. I'm listening with the diaphragm and the bell. Now I'm going to go down to his mitral area, which is the apical, the main point of the apex. And I'm listening again with the diaphragm and the bell. No extra sounds, S1, S2 noted, no S3, S4, murmurs, brutes. And there was no thrills noted either, or heaves. So now I'm also looking at his diaphragm now that he's laying down, and I'm looking to see if he has any aortic pulsations, or I can see peristalsis, or any types of masses, and I don't notice that. There's no types of surgery, or there's no signs that would give me indication of him having previous surgeries, or any signs of infection. And now, so I'm gonna start off by just auscultating his bowel sounds. And he says that he had a bowel movement this morning, right? And normal, okay. Nice active bowel sounds. If I were to hear abnormal bowel sounds, I would do 3 to 5 minutes. And I'm going to listen again on all quadrants. There's no friction rubs that I hear. Nice active bowel sounds. Good. Nice active bowel sounds to all 4 quadrants. No friction rub that I even notice. Now I'm just going to palpate, especially to make sure that there's no inflammation of the liver. And I can feel the liver right in the low, the right sternal border, right at the costal margin, about 1 centimeter below. There's no masses that I noticed. Do you feel any pain?
No pain.
No pain? Okay, good. Spleen is not able to be identified or palpated. Same with the kidneys. There's no signs of inflammation of kidneys that I feel, or any pulsations. Skin is nice and warm. And now I'm just going to, I'm gonna do a deeper palpation Any pain?
No.
Good. I just feel his liver. No signs of the spleen. No signs of masses. No? Okay, now I'm gonna start percussing. Now it's a nice tympanic. Oh, right here it says liver span. And I'm just gonna assess his liver span. Liver span's about 6 centimeters. And I'm gonna, now I've palpated this area, I'm gonna palpate, percuss the other area. Nice tympani sounds. Bladder is also tympani. That means he was able to go to urinate. I had him urinate prior. And I'm also going to see if I can percuss his spleen. Nice tympani sound. Tympani sound noted of all areas. And now I'm going to do, I already did deeper palpation. I'll do it one more time. Any pain?
No pain.
Good. And now I'm just going to listen to his aorta. I'm going to listen to his arteries for any bruits or murmurs. So I'm listening to the aorta with the diaphragm and the bell. And I'm going to listen to his renal arteries, which are just laterally. No bruits or murmurs auscultated to the renal arteries, laterally to the aorta. I'm going to listen to his iliac arteries with both the diaphragm and the bell, which they are right laterally to the belly button. I'm going to listen to his femoral arteries. Due to purposes, I'm just going to do it over his shorts, but normally I would do it with straight skin to skin. I'm going to listen to the other side. And I'm also going to listen to his femoral and then iliac. Good. And I'm just going to palpate his inguinal lymph nodes as well. Any pain?
No pain.
Good. And there's no signs of inflammation. I will listen. I will feel all inguinal lymph nodes going down. And I'm also, now that I have him here, I'm going to feel all lymph nodes axillary. And make sure there's no kind of inflammation in the inguinal part, axillary lymph nodes. I'm making sure that he has no signs of lymph node inflammation, which is not palpable. And I'm going to do it on both sides. And I'm just looking. You know pain?
No
Going
pain.
down? Okay. Great. And I'm just looking throughout. Good. So now that we're done doing that, I'm going to start by looking at his back. And I listened to all that. Now I'm going to start off. And I'm also just going to assess his pulses now that we're here. They're about a class 2 in amplitude, symmetrical, about 60 in pulse. They're pretty even. Now I'm going to start looking at his back. Again, I'm going back to the back just so I could locate his spine, make sure that there's no slip-off, vertebral slip-offs. So can you actually stand up and turn around for the camera so that she can actually see? And I'm just assessing the back, and I'm going to look at the range of motion of the back. And I'm feeling any pain?
No pain.
No? And I'm just going to percuss. Any pain?
No pain.
No?
No.
Any, no pain at all?
No.
And I'm just gonna assess also for CVA tenderness right about the 8th. No, no pain?
Nah.
No CVA tenderness. Shoulders are symmetrical, hips are symmetrical, and the buttocks, the lower part of the buttocks are also symmetrical. So I'm gonna assess the flexion. First, let's start off with the cervical. So first, make sure, can you put your head down, put your head up, extension, flexion again. Now put your head down. We're gonna do lateral. So you're gonna just follow. Now you're gonna move your head like this, lateral motion, back. Okay, and now we're gonna do rotation. You're gonna rotate like this and rotate like this. Make sure and push my hand, push, 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 push. Good. Full range of motion to the cervical area. Now we're gonna do the thoracic area. So I'm gonna hold you, and you're gonna try and kind of push back. Extend back. Good, good, good. Now front. Okay. Now you're gonna do lateral. Yep, like that. Now you're gonna good. Now we're gonna assess the lumbar area. So you're gonna flex. You're gonna pretend like you're gonna touch your toes. And as you're doing that, I'm assessing to see if there's any signs of scoliosis or kyphosis. Make sure that it's nice, good. There's no signs of deviation to one side or mass on one side. Okay, good, great. And that was flexion. He was also able to flex all the way 90 degrees. And you're gonna extend back. So you're gonna go back. Good, 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 good. Okay, good. Now you're gonna do laterally. Now to the other side. And you're gonna rotate now. You're gonna kind of rotate your spine. Good. Full range of motion to the cervical area. And great. Now I'm gonna assess your upper and lower extremities. So you're gonna sit down. And I'm just going to start by feeling all his fingers, his hands, make sure there's no pain or tenderness. You let me know.
No pain.
The skin is good. And I'm just assessing his overall extremities. There's no tenderness. No tenderness no tenderness. Okay, good. So now I'm going to pretend, let me try and open them. Close, yep. Stop me from opening them. He has full strength. Can you grip my hands? Grip, 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 hard, 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 hard. The hardest possible. Good. Now you're gonna you're gonna flex your wrist. So flex your wrist this way. Push, push this way. Good. Now push against my hand. Good, good, good. So now you're gonna do radial deviation, ulnar deviation. Great. Now you're gonna stick out your hands all the way. So you're gonna do supination like this. Both bilaterally and pronation. Great. So now, now I'm gonna assess the shoulder. You're gonna move your shoulder up. The other side. Good. Try and push against me. Okay. And push against. Good. Okay. Now we're gonna do. So that was hyperflexion. You're gonna do forward flexion. This hyperextension. Good. Push. Push against my hands. And okay. Great. You're going to bring your arms out. You're going to abduct. Now you're going to add this way. Okay, that's adduct. Okay, bring the other arm forward towards me. Great. That's awesome. Abduct, full flexion. And now you're going to kind of slowly bring your arms up. Okay. And as you're doing that, let me push, push, push. Good. Push down. Great. So he has full range of motion to his upper extremities. Now I'm going to assess his deep tendon reflexes. I also assessed his pulses already, and I'm going to start with the tricep. So I'm going to hold your, ready? Great. He's about a +2 on his deep tendon reflex. Now the bicep. And let me hold your, Great. So it's about a +2. Thank you. Great. Now we're going to do the other arm. He's about a +2 on his deep tendon reflexes to his upper extremities. Now we're going to do it again. Great. That was his tricep, bicep, Okay, great. About a +2 on his upper extremities, and great capillary refill, which I already assessed that, and strength. Good pulses. Now I'm gonna start assessing his lower extremities. So, Mr. Caballero, what I'm gonna have you do is I'm gonna have you lay down, and we're gonna assess your hips. Make sure you can lay down.
Lay
Right
down.
there. Yep. So I'm just gonna assess his hips. Make sure let me do the work. So, any pain?
Okay.
Okay. So now you're gonna bend your hip. Good. You're gonna go internal rotation, external rotation. Good. Full range of motion to the hip. External rotation, internal rotation. Any pain?
No pain.
Okay, can you do that for me now? Everything I just did? Good.
Like this, like
Yep.
this, like this.
Uh-huh.
Bam, bam, like this, like this.
Good.
Like this, bam.
Great. So now we're gonna place your foot in and out. So you're gonna bring it out and in, just like that.
Okay.
Now, we're gonna do that on this side. In and out.
Now, okay.
That's abduct, adduct.
Okay.
So that's great. Now can you do that for me?
It's in and then out.
Bring
and
your
then
foot
in
and
then
out. Great. So that's the hip. Now we're gonna assess your knee. Also, can you actually extend? You already did in and out. Just straighten out your one more time, like that. Adduct, adduct. Great. Do it again. Full range of motion, about a +4. He's able to do active and passive range of motion, and he's able to also bend his knees fully, full flexion and full extension. There's no signs of crepitus that I noticed or a hip popping that I hear. Flexion. Great. So now I'm gonna also assess your feet. Can you actually? Yep. Wiggle your toes. Great. Now can you plantar flex? So you're gonna bring your toes down. Great. Dorsiflex. Toes up. Great. Can you push? Push against me. Great. 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 Now push against me. Like that. Push out. Great. Push against me. Great. +4. Go back. Go down. Great. Full range of motion to his upper and lower extremities. There's no crepitus that I noticed, and I was palpating as I was doing this. I'm also assessing his patellar, and there's no signs of inflammation or tenderness. Let me know if you have any pain. Great. I'm also going to just assess the pulses. And can she see what I'm doing? I'm just assessing the lower. Can you scoot back a little?
Yeah.
I'm assessing now his pulses. Make sure that I'm assessing dorsolaterales. There we go. They're about +2s on his upper and lower extremities. Good symmetrical pulses. Plantar flexes. Good. Now we're gonna assess his deep tendon reflexes. So now I'm gonna have you. She can't. Let's see. Yeah, like that. I'm just gonna assess his reflexes. Good. Now we're gonna do the other side. He would normally have them down, but it's just for the purposes. Okay, good. +2. Now we're gonna assess his Achilles deep tendon reflex. So you're gonna stand up and just have your foot like this.
Stand up and have the left foot like that?
Yep. And I'm just gonna bang behind his Achilles, which she can't see. Kind of put your foot.
Yes.
So I'm just gonna hit the back of the foot right here. Good. He has great Achilles deep tendon reflex, about a +2. Now I'm gonna assess for Babinski, and I'm just gonna go like this, and I'm assessing for any flexion of the feet, which they should flex, not extend. A baby would, you would only see a newborn do that. Good. So, yeah, great. So, now that I'm done assessing his deep tendon reflexes and his pulses, And then also, if you were, I wanted to talk about testicular self-exam. Do you do that frequently? Do you do that on your own?
Yeah.
When do you do that?
While I'm taking a shower.
Okay, you've been taught that. So just make sure that you continue and feel the testicles, and make sure you feel just to make sure after a shower, a nice warm shower, that's when everything loosens up, and you should be able to make sure if there's a mass, okay? And continue to do that at least once a month so you can know the difference if there's any changes, okay? Now I'm just gonna, now that I'm done assessing that, I also assess the lower part of his body, his feet, to make sure that he doesn't have a plantar foot. And now I'm gonna just assess his gait. Mr. Caballero, I'm just gonna assess your gait for coordination. Can you come? He's gonna walk from that way and come towards me. Walk, 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 and I'm assessing for his coordination, gait, balance. Good. Great. So he, now you're gonna do a step, yep, feet, yep, like that. Great.
You want me to go
Yeah,
backwards?
that's perfect. And now you're just gonna stand in front of the camera, and you're just gonna put your arms forward. Make sure that they don't deviate. Close your eyes. Good. Stop me from going up.
Okay. Yeah.
Good. You can sit down. So this about concludes our assessment. Thank you, Professor, for taking your time and viewing us.